Why? What are you trying to get done? The blue stuff?
No. I'm gonna make it right here. Yes, I'll get it. Oh, thank you. Funded or not?
Hey, Paul. I am well. Yourself? Yeah.
The way it works. Well, I got a little bit of a run around here. There was some frustration, maybe some of you guys did know for a couple of years.
Yeah. Well, we don't have cats. Like cats. Right? It's called like a little like.
All right. Yep.
Good evening. I'll call the November meeting of the Health and Human Services Committee to order. Is there anybody from the public that would wish to address the committee? Any corrections, additions, deletions to the minutes? Well, we'll approve them and roll into resolutions then.
First resolution this evening is amending the 2016 county budget relative to community services programs and authorizing amended agreements in relation thereto.
Motion. Mrs. Fitzpatrick, Mr. Doldo. Discussion. All in favor? Aye. Opposed? Carries.
Anybody?
1,
We have
2,
four.
3, 4.
We have 4. Anybody opposed? Next, authorizing agreement with Advanced Care Incorporated in relation to the provision of certain services for public health home care patients.
Motion, please. Mr. Drake, second. Mr. Doldo. Any discussion? All in favor? Aye. Opposed? Carries.
Next, authorizing agreement with the Office of Aging for the provision of paraprofessional services by Public Health Service.
We have a motion. Mr. Drake. Mr. Doldo. Any discussion? All in favor? Opposed? Carries.
Authorizing agreement with the Sheriff's Department for the provision of nutritional services by the Public Health Service.
May I have a motion, please? Mr. Drake. Mr. Doldo. Any discussion? No? Okay. I do have to say that this seems like a pretty good idea.
No. Okay. Maximizing our resources.
Absolutely. All in favor? Aye. Opposed? Carries.
Accepting funding in connection with the New York State Department of Health Local Health Department Performance Incentive Initiative and amending the 2016 county budget in relation thereto.
Motion, please. Yeah, Mrs. Fitzpatrick. Second, Mr. Drake. Any discussion? All in favor? Aye. Opposed? Carries.
I don't know if there's such a thing as a bonus grant, but kudos to the department for securing the grant because of good performance. Next is reappointing members to the Jefferson County Public Health Services Advisory Board.
Motion, please. Mr. Doldo. Mrs. Fitzpatrick. Any discussion? All in favor? Aye. Opposed? Carries.
The last resolution is reappointing members to the Jefferson County Public Health Service Professional Advisory Committee.
Motion, please. Mr. Drake. Mrs. Fitzpatrick. Any discussion? All in favor? Aye. Opposed? Carries. That was short and sweet, wasn't it? So.
Just like the next one.
So we have some departmental reports here. We also have some department heads. Thank you very much for attending tonight. Is there any desire to address the committee? None at all. Wow. Mr. Monticelli.
Thank you for recognizing me, Chairman. I'd just like to point out that it's really nice that department heads come for your meetings. They don't come for my meetings.
Oh.
I'm crushed.
Oh, this is good fun. Is there any other business to come before the committee tonight? So, seeing none, I'll entertain a motion to adjourn. Mrs. Fitzpatrick, Mr. Doldo, anybody opposed? All right, we're adjourned.
Calling to order the Jefferson County Standing Committee on Finance and Rules, November meeting. Prior to moving into privilege of the floor, just a couple to say. One, I need to apologize to the department heads who are here, the attorney, administrator, and the IT department. Thank you for staying. I hope I didn't create that. And then on a more serious note, I was remiss in saying this at the budget workshops. I never thanked the budget team and the administrator and the department heads for putting together a budget that was under the tax cap, as we asked or hoped for, and had reasonable modifications as we were able to make. So I appreciate that. I want to say thank you for that. And I think those were the only things I wanted to add, I guess. Okay. Privilege of the floor. Anyone caring to speak to the committee? Okay, reading of the minutes of the last meeting. Anybody care about minutes? Okay, they'll stand as submitted. Onward to, I guess, to the first resolution.
Revising and adopting the 2017 tentative budget, and to that page, I believe electronically everybody got a copy of what the finance chair sent out in terms of suggested adjustments.
Can I have a motion, please? Legislator Fitzpatrick. Second. Legislator McBride. Any discussion? Hearing none? Oh, discussion. Legislator Johnson, I didn't see your hand.
Thank you, Chairman. These are the only changes that are going to be made to the budget in solid waste. Is that correct?
Yes?
Correct, as proposed right now, yes.
So the suggestions about adding in or upgrading positions and adding DA's temporary job, and some of those others are where?
When that happens. And it's not off the table, so to speak, but it doesn't need to be dealt with in the budget.
The funding doesn't have to be dealt with in the budget at this time?
Well, either way, it's when do you want to take the money out of the fund balance? Do you have an offset? Did you have an offset for that position? I didn't have one.
Well, I had a couple ideas, but one of them got shot down. But you could always increase the contingency fund. We're taking $1 million out of the contingency fund, make it $1,029,000.
Further comments? Legislator Doldo.
Thank you for allowing me to speak. I know I'm not on the committee, but I don't know what's up with the DA's position. I do support it. I hope something's done with it, but speaking with the DA today, she seemed to tell me a little bit different story than what you're telling me. So I had some questions because she said she has asked for this position and not for the end of next year. So if we can't clarify that, I would bring the DA in and have her explain her position on this. This is an important position as far as I'm concerned. It's in the task force end of it. We do have a very serious drug problem in this county.
The nature of the position is one that there's a cap on the amount that the person can earn in a given year, because we are hiring retirees. And currently, a part-time inspector, investigator inspector, that is assigned to the drug task force. The problem is trying to stretch that assignment for a 12-month cycle with that limitation is the challenge that Christina is facing. The point being that you don't need to make the decision right away is because she's not necessarily looking for two people full-time all the way through. She's looking to try to balance stuff out. So from a practical standpoint, the challenge is more towards the end of the year than it is on the front end, and or trying to balance it so that there's sufficient coverage throughout the year. But the intent is not to necessarily have effectively a full-time position. It's part-time, making sure that there's continuity throughout the year. That's the situation at hand. And As an example, if we hired somebody and they started January 1 along with the other person, we're still going to run into that same cap problem, say, in August or September.
Chairman Gray?
Correct.
No disrespect, I get what you're saying, but at the same token, the one person that's in there is part-time, so if that person only works 6 months out of the year, at what point does it matter if they're working every other week or every couple of weeks or taking a little bit more time off, we have somebody to fill their slot? And that's something that should be in the budget irregardless, whether we use them all or don't use it all, the money's still there and available for this year. And again, this drug problem's not going away in the county, and we either pay for it at the front end, or we're going to give it to social services to help pay for services for the people that are involved in drugs at the other end. You know, it costs us an extra $1 million in safety net next year, or last year. We have indigent burials that they talked about. We're spending it one way or another. It'd be nice to see us try to hit some of it at the beginning, and stop what's going on here before it gets too carried away. It's running rampant in this county. It's not just, you know, I've been fortunate, a lot of us have been fortunate, our kids haven't gotten into it, but I do know families that have gone broke over this. And for us to skimp on $30,000 to hope alleviate some of this problem, I just can't believe that we're even looking at doing, not funding this position. That's all I have to say. Thank you.
Thank you, Legislator Dolno. Any further comments? Legislator Ferris.
Thank you, Mr. Chair. I was approached by another couple people on the board. Same question that Anthony was posing, you know, why not just fund it? Is it an issue with funding 2 part-time people would be the same as 1 full-time person with the union? Is there a reason?
They're not union. There wouldn't be union members at the department.
I didn't know if the union wouldn't allow it because of that.
No, it's a moot point, not a union issue.
I'm in a bad mood then.
Well, we have a resolution on the floor, and we, unless there's somebody makes an amendment to it, as far as I know, we're moving forward. With that, no further discussion. All in favor? Opposed? Motion's carried.
Resolution number 2, appropriation for the conduct of councilman for fiscal year 2017.
Have a motion, please. Legislator Drake. Second. Legislator Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Motion is carried.
Next, certification of taxes to the city of Watertown. Oh, excuse me.
Yeah.
Yeah. Adopting capital plan for 2017 to 2022. Sorry.
Okay, may I have a motion, please? Legislator McBride. Second. Legislator Fitzpatrick, thank you. Discussion on the motion. Hearing none, all in favor? Opposed? Motion is carried.
Now, certification of taxes to the city of Watertown. And again, that number will be specific at our board meeting. It's still a work in progress.
May I have a motion? Legislator McBride, Legislator Drake. Discussion. Hearing none, all in favor? Opposed? Carried.
levying tax map maintenance charges for 2017.
I have a motion. Legislator Drake. Second. Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried.
Next, approving mortgage tax report.
Motion, please. Legislator McBride, Legislator Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Carried.
Authorizing refund of taxes paid by WGS Philadelphia Housing Associates, LLP, due to assessment roll clerical error.
Motion, please. Legislator Drake, Legislator Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Carried.
Next, authorizing the ground lease with Jefferson Community Foundation for the purpose of construction of communities.
Legislator Johnson. Discussion on the motion? Hearing none, all in favor? Opposed? Carried. I guess I missed Legislator Nabawanek and Legislator Dottie. Must have been more energetic. Moving on to number 9.
Appointing election commissioners.
Motion, please. Legislator Drake, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried.
Next is amending the 2016 county budget relative to Board of Elections.
Motion, please. Legislator Fitzpatrick, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2016 county budget in relation to the Employment and Training Department.
Motion, please. Legislator McBride and Legislator Drake. Thank you. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2016 county budget in relation to the Employment and Training Department.
Motion, please. Legislator Drake, Legislator Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Carried.
Last resolution is approving reappointments to the Thousand Island Bridge Authority.
Motion, please. Legislator Drake. Legislator Fitzpatrick. Thank you. Discussion on the motion. Hearing none, all in favor? Just like to comment, I attended the last Bridge Authority meeting, and they were very appreciative. Felt like a rock star at a meeting. I mean, there seemed to be nice to have a legislator there. They thought that was very nice. So anyway, I enjoyed the meeting. It was very interesting, and people from Canada had a hard time getting across the bridge to make the meeting, so it was kind of interesting. Okay, on to General Services Committee sponsored resolutions.
First resolution is amending 2016 county budget and capital plan in relation to the aviation fuel farm repairs at the Watertown International Airport.
Discussion? Or excuse me, I need a motion, please. Sorry. Legislator Fitzpatrick, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried.
Next, amending the 2016 county budget and capital plan in relation to the Watertown International Airport runway 28 and the Taxi A extension project.
Motion, please. Legislator McBride, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Third resolution is amending the 2016 county budget and capital plan in relation to the Highway Department.
Motion, please. Legislator Johnson, Legislator Drake. Discussion. Hearing none, all in favor? Opposed? Carried.
Next, amending the 2016 county budget and capital plan in relation to the road and road machinery funds.
Motion, please. Legislator Fitzpatrick, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Motion is carried. On to Health and Human Services Committee-sponsored resolutions.
First resolution is amending the 2016 county budget relative to the community services programs and authorizing amended agreements in relation thereto.
One last motion, please. Legislator McBride. Legislator Fitzpatrick. Discussion on the motion. All in favor? Opposed? It's carried. Now this is the last motion.
Yes. Accepting funding in connection with the New York State Department of Health and local health department performance incentive initiatives and amending the 2016 county budget in relation thereto.
Motion, please. Legislator, thank you. Legislator McBride, Legislator Drake. Discussion? Hearing none, all in favor? Opposed? And it's carried. The next items are included a monthly departmental report for the county clerk and health benefits. And that concludes business, unless there is some other. Legislator Peck.
Thank you, Mr. Chair. Just a couple of questions, if I may ask of your committee. Looking at the health benefits report, you know, we talk about there the budget presentation, number of employees and how we're down from our historical numbers. And just a generic question for administration, how come we're running so high then on health benefits expenses then if we're decreasing in the overall number of employees?
Well, we are, believe it or not, we're seeing the positive trends and the changes that took place as of April. Unfortunately, we're also seeing some other trends, and I would suggest that the prescription drugs is still higher than it really should be, and it's an answer we're looking to get a hold of. There's also, unfortunately, a couple more tragic situations, but costly health problems that are more significant individually. So the combination of those two things are what's driving it up a little bit more than what we had thought it would be at this point in time. We continue to monitor it. We work with POMCO. We get quarterly reports, and that will continue. And frankly, one of our objectives for next year budgetarily is really to hone in on that, see if there aren't a couple other initiatives that we might want to think about taking a look at. In some cases, frankly, it would require negotiation, so we're not quite there yet. We are looking at a couple of potential scenarios that hopefully have an impact on the bottom line.
If I may, that I'm on the committee that CSEA has with management regarding exactly this,
Right.
and the health, the drug issue, prescription drug issue. It's not that people are taking more expensive drugs because they want to. It's because that's what is available and is prescribed. And they refer to these things as designer drugs, and I would never blame people for being sick using drugs that are too expensive, but that's the deal. They've got, and as you heard with I think the company was maybe Mylan. They had the EpiPen. They were selling it for like 10 times what it should cost. And it's the same thing with these designer drugs. Who knows what it costs? And the actual relationship between cost and manufacture. They still have to have their research and development to get to those drugs. I have no idea, but that's what's available, and that's what doctors prescribe. That's what people need, and they cost a lot of money.
This might be, beyond information beyond what you might know, or is it particular that chronic illnesses amongst employees then that's driving this? Like, diabetes is a pretty common one that has a lot of costs associated with it, with insulin, and obviously I know this with family experience that the costs associated with that just becomes so great the older you get. So is there a correlation then between what you're talking about with prescription drug costs and particular health issues that employees have? And tying into that, is there ways of trying to convince employees to have better health habits?
That is part of the I don't know how that encouraging sounds, kind of not profitable, encourage, but there are programs that the POMCO provides. So it's the administrator of the plan those folks do have things to do exactly what you're saying, to get people to not have to need the drugs. But you can't make people do that. It's an education program. It was talked about at that meeting, and they're effective, but whether or not people take advantage of it. And I'm not sure how much we can talk about what diseases people have. And HIPAA, I mean, there are some requirements that you can't discuss those things. All the paperwork that we have at those meetings gets taken back before you leave. So.
Which is fine. It's just a matter of generic conversation that, you know, if there's a pattern of things that the health administrator can work with to target, so to speak, to be able to market, to be able to, you know, help people with their issues, you know, or, you know, to help live a healthier life. So that's all I'm getting at. Second question was just in relation to some of the revenue enhancements that was brought up last week that some legislators voiced positive feedback for. Obviously, I don't recall seeing anything on that, and some of them require action not until next year. Is there something formal that needs to take place at this point, or is it just a matter of conversation?
In that list of changes that is part of that first resolution are incorporated two very specific programs that will supplement what was going to take place, we had hoped, with the DMV services. In the one case, likely what we'll see, and that was regards to the retention fee for mortgages, I would suspect we'll do a resolution at the next board meeting to kick that into gear prospectively to hopefully soon after, if not by the beginning of the year, have implemented that particular program. So the other one in regards to mortgages, that's going to be a process we will go through probably shortly after the first of the year, because that will take board action, but it goes to the state and then it's back and forth. It's one of those, not unlike the sales tax request, because it is the state legislature that has to give approval. So consequently, the number we're suggesting isn't anywhere near an annualized number. It's a 1 quarter in anticipation that we'd be successful, but it would still be prospectively implemented. So the answer to your question is yes, it's already contained dollar-wise, and between next month and probably early first quarter of next year, we'll start the other process. And that will be board action.
Have we satisfied your concerns about healthcare? I probably couldn't satisfy them, but have you had close enough for tonight?
I'm satisfied for the moment.
An interesting thing, Legislator Peck, at those health meetings, would they discuss the air ambulance and the cost of that? I mean, we know we're very happy to have that out at our airport. It's a good thing to have there, the running space. But the cost of it, if a county employee has to use it, it would have a tremendous impact on the cost of the plan.
It's anybody in the county that has to use it.
Well, but only that it only affects the county budget if it's a county employee. That's my point. Anything further? Motion to adjourn? Thank you, gentlemen. Legislator Drake, Legislator McBride, and there wasn't any more enthusiastic to adjourn than to have the meeting go on. So, okay, thank you very much. We're adjourned. These are